Stephanie Bell-Flett joins us now to talk about valve replacement. If you have questions, please send them to the doctors at WLBT.com.
This has become kind of a common thing. Joining us is Camille Richards. She's a nurse practitioner at Baptist and coordinator of the Valve Center. Thank you so much. Tell us, the Valve Center, is not in the cardiac unit?
Well, actually, it is a part of the cardiovascular services offered at Baptist. But what we have done is we have kind of streamlined the process on how patients are seen and evaluated when they have a valve problem. What we're doing is we are offering a program that a patient can be seen in one day, where all testing is done in the morning, and they're seen by both a cardiologist and a cardiac surgeon all at once.
Now, is that what makes this unique? Is that instead of having several steps, they can get everything done right here at this center?
Exactly, it really is. Patients have gotten frustrated in the past. You go to one physician, they send you to another physician, you get a series of tests, then have to go back to another doctor to find out the results of those. The fact that we're going to have the patients come in the morning, have all the tests run, have the results of those tests waiting for both doctors to review, and the benefits of having two specialists instead of one evaluating these is that all treatment options from the least conservative to more conservative can be addressed all at one time.
Let's talk about the heart, the valve. Tell me why heart valves are so important, what their function is.
The heart is a very, very strong muscle that obviously pumps the blood throughout our whole body. Well, the valves are the backflow system that prevents blood from going backwards when the heart is pumping. If a valve is narrowed because of calcium buildup, a lot like atherosclerosis for people who have coronary artery disease, or if it's weak or leaking, then blood can seep backwards, and obviously that's not a good thing. That means less blood is going forward through your periphery, through your body, to your lungs. A lot of times the patients come in and their doctors know that they have a valve problem because the doctors hear a murmur. The backflow of that blood creates a swishing sound, and that's what's called a heart murmur.
How common is this amongst the average person, would you say?
It really does depend. I mean, there are some congenital issues, though people are born with this,
right,
that have weakened connective tissue, and some of them aren't found until later in life. But unfortunately, most of our patients are older when we do have calcium buildup, so we've had a lot of time to feed ourselves the wrong things. Mm-hmm. And a lot of times our patients are in their 60s, 70s, and 80s. And to answer your question, actually, that number of patients we're taking care of is actually growing because of our aging population.
Tell me how, for people who aren't familiar with cardiovascular stuff, what do you replace the valve with, and what kind of surgery is it?
There are a lot of different ways that we can fix and replace valves, and I'll talk a little bit first about how we fix the valves. We can do a minimally invasive surgery, so it's a very small 2 to 3 inch incision that can be done through the front of the chest or the side of the chest, which is a lot more cosmetically appealing. Those repairs can be done, and most times patients are out of the hospital within 3 to 4 days. Now, for a larger repair or a replacement, we do have to use either a mechanical valve that is made by man-made parts, made from man-made parts, or we use a combination of animal parts from pigs, cows, and they are made to assimilate to our bodies, so our bodies won't reject them, and they function just the same as our valves do.
So that procedure is very successful with patients who get it.
It is. A lot of these patients who get the mechanical valve, you have to be on a blood thinner for the rest of your life. If you have the other valves, you don't have to be on that, the high maintenance that you would have with a mechanical valve. So obviously it's a lot more beneficial. Now, the open surgery, in order to have one of the larger valves, typically does require a large incision. However, there are some new techniques, new technology that are allowing us to make smaller incisions and hopefully no incisions at all down the road.
Well, what should someone do if they want to become a part of the Valve Center?
Well, we are accepting new patients and not just referrals, so that's the biggest part of what we're doing now is if you know that you have a murmur and you want a second opinion, you can call and make an appointment or ask to be evaluated. At that point, I will go through all the information that is needed to find out what other tests need to be done before you see the physicians. Obviously, if it's a physician that wants their patient to be seen, same process, they call, I'll collect all the information and make sure the patient's seen in a timely manner.
All right, well, we appreciate it. Camille, thank you so much from the Baptist Valve Center that is up and coming. Thank you so much. And for more health news, you can log on to our website, WLBT.com, and click on Medical Matters.